So, another thing that they gave us during the home assessment was it's called the Foster Parent and Child Placing Agency Agreement. So, this was just one page. So there wasn't anything for us to sign that was attached to this. There may have been another document that we actually signed, but this is. Let me see here. So basically you're agreeing, even if you're doing matched adoption, and this is something that people have to be very clear about, that even if you're doing matched adoption, it's going to be considered like you're a foster parent. And so there's a monthly reimbursement. Each agency is different in regards to if it's, one time a month, or if it's like twice a month that you're going to get the reimbursement. But it says for foster parents, upon the number of children placed in the home and the number of days each child was in placement and service package designated for each child. So each child is going to be at a different, level, or it could be the same. But it doesn't give too much detail on here. But I mean, I'm sure when you get the profiles of the kids, which when you're doing matched adoption, you're probably going to get emails or something with the documentation to review. But when you do foster care, it's basically a call, and you want to have just a few questions of things that you already know, like you want to know about the kids. And so that way you can ask whoever's there, but you have to be very quick about it, because they will call somebody else, or there may be somebody else calling and trying to get the kids placed. So once they're placed, like, you lost your opportunity. So don't spend too much time on the questions. Just, 2 or 3 questions that are very important to you, and they may not have the answer, so it's not going to be very helpful. Okay, so anyways, so you're considered a foster parent until you're not, if you're going to be doing matched adoption. Okay, so at my agency, the reimbursement period the reimbursement, is payable the 10th and the 22nd of the month of service, and the primary service package. So, for example, if a child is basic foster family home support services, then the foster family daily rate is $46.90. So this is almost like double what it was like almost 10 years ago when we did foster care last. And so this is helpful, because it just provides you a little bit of assistance for like things that you're already going to need for the child, and just that additional services that they're going to be needing. It said, the next one says substance use support services. The daily rate is $59.57. Short-term assessment support services, it says in parentheses. Okay, back to short-term assessment and support services, parentheses, not eligible for add-on services. The add-on services, we'll talk about that in a minute. That is $73.18 daily rate. Sexual aggression, sex offender support services, that is, I skipped one. That's $90.78 daily rate. Mental and behavioral health support services, that's $73.18 daily rate. Complex medical needs or medically fragile support services is $93.27 daily rate. Intellectual or developmental disabilities, IDD, autism spectrum disorder, that is, where is it? Support services, $90.78. Human trafficking victim survivor support services, that's $100.71 daily rate. Then the last one is treatment, foster care, foster family care support services, that's $139.58 daily rate. Okay, so add-ons, this is what it says. Transition support services for youth and young adults add-on service. The family daily rate is $26.12, and a youth is 14 and up. Kinship caregiver support services, add-on services, NA not applicable. Pregnant and or parenting youth or young adult support services, add-on service, $26.28. Okay. The foster family agrees that all non-relative children accepted for 24-hour care will be through the agency, which is also CPA, which is the child placing agency, and no other source. The agency has a right to remove the children at its discretion. Visiting the child's parents or relatives will be arranged through the agency. The agency is responsible for regular supervision of the foster family home, so they will be visiting. I think the care manager or the case manager will be visiting, and then I think the maybe the like for our home through the agency, and then the child's case manager or CPS worker, whoever they are, they also can come in to the house. And the supervisor, I believe, of our case manager can also come. And those are like, some are unannounced visits, some are visits, you know, whenever they want, or they may schedule them. The foster family agrees to maintain compliance with all standards as reflected in the agency foster home policies and HHSC minimum standards, including policies for child care, discipline, and supervision of child and children's visits or trips away from the foster home. So, my perspective on that, like sometimes people will get respite, like when they go to family visits or road trips and things like that. And I'm kind of like, if you're doing a family trip, you're doing a family trip. Like whoever's in your home should be a part of the family. You just request for that time, you know, getting that approval. And we've done that. We've had foster kids and we took them with us, and it was a good experience. And I think that they really enjoyed it. We went to the beach. We went to Destin, Florida, and so it was nice. And so even with my own kids, I rarely leave them with a babysitter. They're away from us for a while already. You know, they're at school, they go to church, they go to church groups, they are in sports sometimes, or, you know, doing stuff and, you know, with friends. And it's like, they're already away from us for so long. And, you know, it would just be a last, you know, resort thing. I wouldn't want to do anything major like that. But sometimes you have emergencies, and unfortunately you don't have like a whole bunch of people approved. Some people do get a lot of people approved, but you can always use those respite services if an emergency arises. And our agency has been very nice and has said, you know, we have families that are on standby, like that they can do those emergency respite. So on some of our documentation, we did put like, you know, for our kids, like we would just have them with a family member if for any reason something happens to us. We could do that. There's no big issues. But if you have foster kids, then you do have to have like background checks and things like that, like prior done before you can actually put them in their care. So if something like that were to arise, of course we would, you know, we already have one person that is background checked, and we would use that person first. If we're not able to use that person, then we would say, okay, we need to do emergency respite. But outside of that, for like holidays and road trips and family things, like they're coming with us. Another form that we got during our training that we went ahead and submitted right before the home assessment was the disaster plan for DFPS foster and adoptive homes. So that is on the actual website of the Texas Department of Family and Protective Services. It's called Form K908-2288. And the one that we have was revised in April 2020. So I don't know if there's a newer form, but this is what they gave us. And it's basically talking about those plans. You want to get to the point where you're talking about like what would you do with the kids in case of a disaster? What is the plan? And what if, something terrible happens to your home, but then like, what if something terrible happens to you? And so sometimes people don't want to go there because they're just not thinking about it. They don't have a will, blah, blah, blah. But it's important to discuss it and have it in writing. So even if it's not, something that you've thought about before, it's going to be required for you to at least go there, write it down. We cannot foresee the future, but we want to have some things on paper so that the agency knows like what we would be doing. And some of these things, if we had an emergency, we would just naturally do these things without actually, putting too much thought into it. We would know this is what we're going to do. If your house is on fire, you're going to evacuate the home. You're going to probably go stay in a hotel. Sometimes, Red Cross will pay for your hotel. Sometimes you can, just file an insurance claim and they put you in a hotel. It just depends what the situation is, but I'm just saying like a fire as an example. So, yeah, so there's a lot of questions that they will ask. We haven't gotten to the home study to the best of my knowledge. They called it a home assessment, so we'll find out soon what's next. But if we have a home study, I will definitely share that and what the process is. I'm sure that we'll be going over some of the questions that we've already answered in those, the questionnaire and the child preferences that we discussed before, and those responses, and like if they have any questions based on our responses, so that we can get that home study done. Once we have it done, we'll request for a copy so that we can start submitting it to the Terra website or the Heart Galleries of North Texas to to inquire about kiddos and see if we can get on the list of homes that are approved and maybe able to make it to where we can be selected for those kiddos. So more to come, and we're excited and just hoping that we can keep the process moving. I'm pretty good with paperwork and completing it, but sometimes it if there's more paperwork and I just don't know, we haven't got to that point yet, then there's nothing else to do but to wait and go through the process. I know there was a little bit of a delay, and not really a delay, but just with the holidays and things like that, it takes a little bit more time. People are not in the office. People take breaks, vacations. There's days off in the office, so it definitely prolongs the process, but that's okay. We're patiently waiting through and hoping that we're able to reach our goal of adopting 1 or 2 kiddos that are in foster care.